Hi, I'm Brent Petty, industry consultant for Lexmark Healthcare. Today we're going to explore what hospitals use to make their decisions. As a reminder, hospitals and health systems continue their dramatic change in their business model due to some forces that were predicted to turn healthcare upside down. Forces such as providers concerned with transitions from volume of services they provide to the value of services they provide. Forces such as communities who are demanding high-value services and emphasizing keeping the population healthy and the cost affordable. With these demands, the criteria that hospitals and health systems use to make decisions substantially changed, with the biggest change occurring on March the 23rd, 2010. As a reminder, on March the 23rd, 2010 was when the Affordable Care Act became law. For the first time in our history, our federal government became more than just the largest payer in health care. They became a partner in learning how we can reduce the consumption of health care. They became a partner in learning how our hospitals and health systems, with a target of increasing the quality and understanding the cost with the goal of reducing that cost. While there are hundreds of priorities that healthcare works on every day, there are three common denominators that serve as a platform for their decision-making process. They are the current state, they are the total cost of ownership, and the understanding of cost, quality, and outcomes. Let's briefly explore these three. Current state, or simply put, what are we doing today? There are many steps to understanding and completing a project, but all have a foundation in understanding where we are beginning. Understanding your baseline or your starting point is key to success. In healthcare, often to establish our baseline, we have to bring in a subject matter expert. Someone to help us define our current state. This is often a supplier partner. Someone who can bring resources that expands our bandwidth and our expertise and allows us to understand our organization's future state. Total cost of ownership. Although not completely understood, as I still do not see safety or things such as human factor engineering built into our procurement processes, or even a complete understanding of the cost of patient care across our care continuum, or a complete understanding of the non-acute care segment. So the challenge is to discover and understand the complete process from the patient's journey. Not from admission to discharge, but from diagnosis to cure, and applying the cost to each of those steps. Cost, quality, and outcomes. The Institute for Healthcare Improvement, the IHI, establishes the noble goals of improving the individual care, improving the health of a population, and reducing the costs per capita. With that, in 2013, AHRMM launched the Cost, Quality, and Outcomes Movement, CQO. Recognizing cost, though important, is no longer the primary element supply chain uses to make its decisions. Rather, it is one of the many factors to be considered when organizations take a holistic approach to the decision-making process. The CQO movement was designed to help understand and tie cost to quality with more predictable outcomes. The CQO movement was designed to help healthcare run their business. In conclusion, suppliers, along with the supply chain that embraces and focuses on discovering the current state, the total cost of ownership, and cost, quality, and outcomes, and operationalizing each of these, are beginning to see the impact and in enabling their organizations in making strategic decisions, optimizing performance, and patient care. I thank you today for joining me with this, and I appreciate all you do in the healthcare supply chain.